It has been quite a day, and so you're gonna get me in my brand new Christmas pajamas, and absolutely no other effort is gonna be put into my appearance. I gotta show them off though. How adorable! But anyway, it's that time of year again, so I think we better have a little bit of a talk. Hey everyone, welcome back to my channel. My name is Stephanie and this is all about my life after gastric bypass surgery. And today's video is going to be a little bit of a heavy topic, and I'm going to be talking about disordered eating. But I'm not talking about disordered eating prior to surgery, how me or other people may have gotten to this point and turned to surgery. I'm actually going to be talking about disordered eating after surgery and how common that actually really is. But before we get into all that, just a little bit of housekeeping. If you are a returning subscriber, thank you so much for subscribing and following my journey and supporting me on this channel. And if you're not yet a subscriber, I just ask that you consider subscribing at the end of this video if it is something that you enjoyed and if it's content that you would like to continue seeing me put out. And make sure to ring the little notification bell so you get notified when I do put out a new video. And as I said in my last video, I am on the countdown to 1,000 subscribers to be a legitimate channel and get monetized. So if you do like the content that I put out and the research that I do, that's the best way to support me at this point, and I would love you forever. I'm going to start off with a little bit of a disclaimer. I am not a medical professional. I am not a mental health professional. I am not qualified to diagnose anybody with anything, nor is this content that I'm putting out today intended to diagnose anyone with anything. And I do not support or promote self-diagnosing. And the information that I'm going to put out today is really just kind of breeze through, informative. It's nowhere near enough to actually be able to diagnose anyone with any sort of disordered eating. That's not the intent of this video. I want to bring attention to these types of behaviors and these types of thought patterns and things that are really common, more common than you think after surgery, especially because this is the time of year that I start to see this, and this is the time of year that people start to talk about it without realizing what are the implications of what I'm saying and how is this affecting me in a big, broad sense. So as I said, I'm talking about disordered eating today, and this is the time of year that I see these comments and hear these types of conversations happening the most. When you start to get into the holidays, you start to get into a lot of those moments that revolve around food. And this happens even if you're not in the weight loss surgery community. This happens with everybody, even if they're not really on a diet either. I mean, it's just kind of it seems to be the cyclical thing that everyone does, is everyone feels like they're cheating and being naughty around the holidays and they need to nip it in the bud or they need to comment about it. And so there are a lot of these conversations coming up this time of year about, I did a bad thing on Thanksgiving, or I was really naughty this weekend at a Halloween party, or I went to a Christmas party and I ate things that I shouldn't. And you guys should know by now that I don't really enjoy that kind of language. I don't enjoy that kind of thought around food. I think that that has been the majority of my life for so long. I'm trying to get away from the idea that food is bad in any particular way, or that there's any morality assigned to how or what you're eating. I've already seen several posts in the Facebook group that I'm in saying that they were naughty over Thanksgiving and they wanted to do a pouch reset. And all I see when I read comments like that is, I ate food, I shouldn't have eaten food, I'm gonna not eat food for a while to punish myself. And I'm sure that is not the intent, or at least the explicit intent from what people are saying or doing when they're doing these things, but that is the general mindset and mind frame around these types of comments. So it got me thinking about disordered eating after weight loss surgery, and how common is that really? Because I see an awful lot of people after surgery have a tendency to be extremely restrictive with their food, or have very strict food rules that they have to follow, and things that I really feel are borderline unhealthy relationships with food that are put out there as if they are a healthy, normal thing to be doing after weight loss surgery, and it's just not true. Disordered eating after weight loss surgery is actually more common and problematic than most people think. And most studies agree that more research really needs to be done in order to begin to shed light and offer help to weight loss surgery patients. In 2014, the Johns Hopkins Eating Disorder Program found that 8% of their patients actually had a history in bariatric surgery. Eating pathology is common to see pre-surgery, but many persist and often develop after surgery as well. So eating pathology can be defined in multiple different ways, and often it can walk a very thin line between what is a common practice for weight loss surgery patients and a problematic eating behavior. This is why a lot more research needs to be done in this area, because weight loss surgery patients are very different from the general population, and diagnosis of these issues can be a lot more difficult. For example, some signs of disordered eating can be things like excessive calorie counting, weighing out your food, or cutting your food into really tiny bites. But post-bariatric surgery, our anatomy and our needs are very different, and that leads us to do these types of behaviors, not necessarily because it's a problematic eating, but because it's something that we need to do anatomically for our post-surgical needs. So these behaviors aren't in and of themselves problematic or disordered in any way necessarily, but if they're coupled with other behaviors or other thought patterns that can be problematic, and it leads to a disturbance of your daily life or your mental health, then it really should be addressed by a mental health professional. Other common disordered eating patterns can be severely limiting your food choices, persistent thoughts about food or about eating, preparing elaborate meals for other people but not partaking in them yourself, having very elaborate or very restrictive food rules that you follow, checking your weight frequently, or self-checking and comparing yourself to other people in terms of your thinness, and generally having a negative body image. Now again, that's not to say that any of these behaviors in and of themselves are inherently problematic. We need to delve into the reasons why these behaviors are done, why people are eating the way that they are, and why they're having the thoughts that they're having. Because just these behaviors and these types of things by themselves aren't enough to just say there's a problem with this eating behavior. But then you get into some of the more common and the bigger, what we would consider eating disorders. And the common ones that people see after weight loss surgery would be binge eating, which is typically eating large amounts or larger amounts of calories within a 2-hour window of time. So typically just like large meals at a time. And that often revolves around secretive eating and feeling shame about what you're eating and how you're eating. There's also night eating syndrome, which can be consuming large amounts of calories at night, like after your main meal, or waking up in the middle of the night and eating. Then there's picking and nibbling, or also known as grazing, where you are eating typically like every couple of hours and you're basically eating all throughout the day. So you end up getting an excessive amount of calories over the course of the day rather than eating a lot at one time, like binge eating would be. This is a little bit more common after surgery because anatomically, most of us, especially soon after surgery, can't physically eat a lot at one time, but we may be able to spread it out throughout the day and essentially eat all day long and still end up gaining more calories than we need. And then the others that are seen are intentional vomiting, misuse of laxatives, diuretics, diet pills, or over-exercising, especially if it's in response to what you're eating, and then chewing and spitting out food so that you're not actually consuming the calories. Again, these behaviors can walk a very thin line between being a problematic disordered eating pattern and just kind of a habit that was formed after weight loss surgery that doesn't really have necessarily a negative association with it. And it can be really hard to actually diagnose disordered eating with weight loss surgery patients because typically we don't meet the requirements that a lot of the diagnoses have. So for example, for a diagnosis of anorexia, somebody would need to be under the normal BMI of about 25 in order to get that diagnosis. But it's actually extremely uncommon for weight loss surgery patients to be under a normal BMI. And even if they tick all the other boxes, you wouldn't meet the requirements for that particular diagnosis. Thankfully, the DSM-5 has allowed for the ability to diagnose other defined eating disorders or undefined eating disorders. So it's allowing for some of these other atypical situations to actually get a diagnosis and subsequently help. So now they're able to focus on things like post-surgical eating avoidance disorder, where somebody stops eating or purposefully eats very little in order to avoid weight regain, or something like loss of control eating, which focuses more on mindless eating and grazing throughout the day and doesn't necessarily have a 2-hour eating window that the binge eating disorder requires for a diagnosis. But here's the thing, why are we talking about this, right? I see these types of things talked about and commented on frequently after weight loss surgery. People having very strict rules about what they can and can't eat, people choosing not to eat and putting themselves through a pouch reset and a liquid diet because they were naughty on Thanksgiving, and almost this competitive attitude sometimes on who can eat the least amount of food. I do believe that these things are all done with the best intentions, right? People don't want to mess up their surgery and they don't want to gain their weight back. But exchanging one disordered way of eating for another is not the answer. But don't just take my word for it. The statistics and the studies coming out have all consistently showed us that these things and these behaviors are actually all linked to significant weight regain. In particular, binging, grazing, and night eating have all been consistently linked with greater amounts of weight regain. I'm always saying it on my channel and I will never stop. Mental health is the most important thing to focus on in this journey. Your thoughts around food, why you behave the way you do, and why you overeat all need to be addressed if you want to be successful after weight loss surgery. It's not simply about what you eat. It just doesn't boil down to being as simple as that. I'm going to end on a case study that I read that was published in February of 2020. And the purpose was to explore the experiences of women who had developed excessively restrictive eating patterns after weight loss surgery. All of them were women who were at least 9 months post-op. And what they found in this case study were 3 major themes that kind of developed. The first was prior experiences with weight stigma, bullying, bad experiences related to growing up overweight, things that really made these women fear regaining their weight and going back and experiencing those things again in their lives. The second focused on the impact of loose skin, but the way I was reading it and the way that I was understanding was really more focused on body image, and not just body image, but body dysmorphia. The things that these women were saying revolved around not seeing the same results that other people were, and looking at their bodies and either feeling like their loose skin was hiding what results they had, or simply seeing their old bodies still. And all of that was involved with just overall having a very negative self-image and a very negative body image. And the third theme was thoughts revolving around food changing after surgery. Feeling like food is now fuel and no longer meant to be enjoyed. But it wasn't just that. There was also this shame around feeling any sort of enjoyment with eating food. One participant said that she didn't want food to be her enemy again, so she just avoided certain foods. The study concluded, like most of them that I read, that this really needs to be studied and explored more. But more important, it was critical that it got more attention so that people suffering from these conditions are provided with an appropriate framework to identify and legitimize their symptoms. And they concluded that it's so important to support early identification and improve people's lives and their mental well-being following bariatric surgery. If you feel that you may be developing an unhealthy relationship with food or problematic eating behaviors that are impacting your daily life and your mental health and mental well-being, I encourage you to talk to your doctor about it. And the National Eating Disorder Association actually has a hotline and an online chat available, and I'll link that in a pinned comment down below in case you want to check it out. Thank you so much for watching this video, and I hope the information was helpful. I'm also in the description going to link several of the studies that I used for my research in case you wanted to read through it. And I do encourage you to do some extra research on this topic, especially if you feel that you might be developing some disordered eating patterns or behaviors, because our community of post-op bariatric patients really doesn't get the kind of support and attention for these types of things, and it's a lot more prevalent than people give it credit for. A lot of us pre-surgery describe having an extensive dieting history, and these things all still come into play, and surgery itself doesn't just take care of the issue. So it's important to do the research and have an understanding of the things that can crop up as what I would consider a complication post-surgery. So again, thanks so much for watching and supporting this video. And if you like this kind of content and this kind of research, please go ahead and like the video so that I know and I can continue putting out this type of content for you in the future. As always, stay happy and healthy, and always remember to celebrate the little accomplishments along the way. And I'll see you guys in the next one.